Hospital at home is also another model of care that's actually been around for a while, since almost the 1970s, but it's much more developed in other countries, for example, in Australia. And it hasn't really taken off in the US, again, because there hasn't been a payment model to support it until recently because of the pandemic with the public health emergency. And so CMS has actually been reimbursing for care. So this allows hospitals to send patients home when they have no more capacity in the hospital itself, and also have like a little bit of a safety net around them so that there is actual care being delivered. The reimbursement is the same as if the patient would be actually admitted to the hospital. And the criteria for that patient to enter this program is also the same. So if you have a patient who comes into the emergency room and you would normally be admitting them to the hospital, but for a variety of reasons, that care may be delivered at home, and it may be either a better option or at least an equivalent option, there is now that opportunity to do that. There's a lot of criteria that have to be met, including some that are very basic. So you need to have, for example, electricity in the house. You need to be less than 30 minutes away from healthcare in case of an emergency, and all sorts of lists that you need to just sort of check off. And as of right now, with CMS, there's like less than 10% of hospitals, about more than 4,000 hospitals in the US that have actually signed up for this waiver and for this program. But it seems like it may be a growing program. So there are, there's so many reasons why it may be a good option for hospitals and for patients too. So if you would imagine yourself, if you had an infection, for example, and your option was to be able to go home, have someone come to your house and check your vitals twice a day, make sure you actually got your medications, and you had options by either telehealth or by phone, you would be able to contact a healthcare professional immediately and still have your own food, sleep in your own bed, and your recovery may be faster, and you're not too sick, obviously. You can't be in the intensive care unit level sick, but you are sick enough to actually need all the services. And you can have oxygen at home. There can be portable chest x-rays and other imaging that can be done in your house. So it's actually pretty amazing what we can do in someone's home these days. We developed the criteria that threads the needle, basically. You're not too sick, but you are sick enough. It's not observation care. So observation care is for when you're not sure if you actually need it at the level of a hospital. This is, you do need a level of a hospital, but we can, with all these caveats in place, we can deliver that care for you at home.